The economic pressures affecting various means of livelihood in Nigeria could be the source of depreciating mental health among the citizens. And critically, this is a view that apparently shared not just among people in the streets, but also in policy formulating and implementation circles. The age-old belief that a sound mind breeds a healthy nation. How can Nigerians be adequately insulated from the challenges of mental health? What are the basic do's and don'ts that every discerning individual must adhere to when it comes to mental health? Dr. Maymunah Kadiri is an authority on this, a foremost voice and interventionist in mental health issues in Nigeria and beyond. She joins us now to take us through these issues. Great to have you with us, Doctor.
Thank you.
So, you've heard the intro. How prevalent is mental health in Nigeria, and how would you also assess mental health awareness within the country?
1 out of every 4 Nigerians will have a mental health issue in their lifetime. This just means you could be dealing with it already, it could be happening now or in the near future. And the reason for that is because of the World Health Organization statistics. But currently, we have over 30% of Nigerians that have mental illnesses. So if we are 200 million Nigerians, 30%, you know what that means. Indeed. But the sad part of this 30% is that access to mental health care, it's highly limited. Over 85% of individuals do not have that access to adequate mental health care because we haven't gotten to mental health equity services available. None of our primary health care centers across the country, where we have over 20,000 primary health care centers, have mental health services within.
Wow. And
so when somebody has issues with mental health, they're not just going to General Hospital or Federal Medical Center, they are going straight to a tertiary institution like Yaba, like Lasut, and that is not supposed to be. With the statistics of less than 250 psychiatrists to 200 million Nigerians, meaning 1 psychiatrist to 1 million Nigerians, we need a way out. We need to be able to deploy what we call tax shifting and tax sharing, whereby other people within the ecosystem can be trained to elicit those early signs and symptoms and be able to refer appropriately.
Which goes back to what I'm going to ask now. Is the symptoms of mental health? What are they? Because it's worrisome, the statistics you just gave out now. But what are the symptoms? How do you actually determine that someone has the traits of mental health?
Great. I love that, because when we look at the definition of mental health, so this is where a lot of us also miss it. We kind of use the words interchangeably, but it's not. Mental health is different from mental illness. Okay. Mental health is part of our health, which is, it can be physical, it can be mental, right? And World Health Organization says it is the ability for, number 1, for you to realize your potentials in life. Number 2, for you to deal with the day-to-day stresses of life. Number 3, for you to be able to work productively and fruitfully. And number 4, for you to be able to give back to the society. That is mental health. But mental illness is a medical condition. It's a medical disorder. So it could be anxiety, it can be depression, it can be substance abuse. So mental health affects the way we think, the way we act, and the way we behave.
So to a large extent,
symptoms,
symptoms are the stimulus.
Exactly, from the way we think, the way we act, and the way we behave. So the one word I always tell even a layman is change.
All right,
what has changed in you from yesterday that you are noticing today, and if you don't do something about it, it escalates. Are you sleeping poorly or excessively? So sometimes people think it's when you are sleeping poorly that is the only symptom. It could be you sleeping 20 hours, but you wake up, you are not refreshed. Is there change in appetite? Are you eating less or you are eating more? Is there change in mood? Are you now more withdrawn, crying easily and all that? Or you are not so happy, over familiarity with other people, or even so energetic? Change in energy level. Are you now, have less energy? Wake up in the morning, you don't want to talk to anybody, you want to hide, you don't have the zeal or will to, or you have so much energy. So you see, it's changing all these things up to the extent where people start having poor concentration and attention, where they start hearing voices. So it doesn't just go straight to you being suicidal. or you see have you been as you hallucinating or having delusion? Have you started hearing voices or seeing strange things in clear consciousness, meaning you are not sleeping, you are seeing them? Like now I'm talking to you, I'm like, are you not seeing the person that is talking to you and would you run?
Hallucinations.
Hallucinations. Then delusions, thinking everything is bad, the world is against you, there should be rapture, people should just die now. Then people start feeling hopeless, worthless, and helpless.
All right, very good, Dr. Kadiri. Can we link depression directly to acts of suicidal tendencies?
Yes, the first on the rank.
We're seeing to a large extent, a worrisome development or trend in Nigeria whereby it's escalating. The use of snipers and,
You can say that, in fact, well documented, well elaborated researches have shown the link between depression and suicide. Why? Because at that point in time, the person feels hopeless, worthless, and helpless. Yeah. So they just want the pain to go away. They want to be able to sleep better. They want to take away the trauma. And so they just believe that if they die, that everything will end. There wouldn't be a burden to people again. And that's why you see some people talking about, I know if I die now, you people will not cry. You people will not take care of me. You people will not think about me. And that is why we talk about suicide and suicidal thoughts are different. When people die from completed suicide, it's sad, it's a tragedy, people are there, they think that, what did we miss out? But when people have suicidal thoughts, people think their attention sinking. They are not available. They avoid them. They think they are irritable. They think that they will not carry out the act. And so suicide, for every 40 seconds, somebody somewhere is dying by suicide. And
of course, just before we came in, we were talking about the issue of the killings in other parts of the world, in the United States, and just in Brazil recently. So could we say to a large extent the mental health disorder is a form of stimulus to that? It
is. So another thing again is that sometimes, when those things happen, they try to look for where to attribute it to. Could it be that person has a mental issue? Is it drug, substance abuse? Yes, there are researches that also back that up, but we also have to look at the environmental factors, policies. Look at America, the gun mass shooting and all that, over 600 in 2022 alone. And when you bring it home to Nigeria, could that also happen in Nigeria? I will tell you for free, that it's possible. The only thing we are having is that I think availability to these weapons are not so available. So available, and so people don't just carry guns, because now it's all American. Now look at Brazil. You think Asian people are very cultural. So why would you go, a 16-year-old go to his former school and shoot his teachers?
But the warnings could have been there. The signs could have been there.
Exactly. So there were So those are those things we're talking about. Those changes. What has changed in that child? What are the withdrawal symptoms? What are the mood changes? Which
brings us to the level of awareness of society itself for those tendencies to happen.
So we still have a huge barrier, a lot stigma and discrimination attached to mental health. People will live with mental illnesses, including their families. People still see it as a taboo. If I come here and say I'm depressed and I'm taking antidepressant, two things: either people, negate what I'm talking about and say, what's this one talking about? Everybody in Nigeria is depressed, or they start running away from me and they don't even talk to me anymore. Like, I'm a physician, I'm a psychiatrist. People don't call me my friend.
In fact, my friends, the derogatory shrink. They call them
shrink. So you see, my friends, rather call me, Dr. May is my doctor. They're like, no, Dr. May. Rather, people call me my friend, rather my doctor, because they believe, they say I'm their doctor. That means their case is really bad. And that's why Yaba is still known as Yaba left, Yaba Ekposi. But if you've ever been to Yaba, which side of the road is saner? Is it left or right?
Good question. But doctor, let's take a look at this. On a long term, depending on the types of mental health issues, what kind of treatment is readily available? Yes, you talk about Yaba and all the stuff they go through there, and but how can you enlighten us more on that?
So we have every medical condition. So mental illnesses are under non-communicable diseases like hypertension, diabetes, cancer. So you see people showing a lot of sympathy to people that are diabetic, hypertensive, or have cancer as against people that have mental illness. So what are the treatment available? We have public services, we have private services, but it spans from what is this person's diagnosis. So the treatment spans from preventive to treatment. Mental illnesses are not curable, just like many medical conditions, but they are treatable, they are manageable, they are beatable. So counseling is available, therapy is available, medications are available. Some people may be in the extreme of cases, maybe severe depression, that is suicidal. That kind of person may need admission, and then the person can be medicated. But we've also seen with researches that when there's combination, they tend to outcome usually is better. So if the person needs medication and also going through therapy, the outcome is better. And we do not take spirituality also away from medical conditions. So people will always say, what about the role of spirituality? So
all options are open.
All options are open. So when you are more spiritually minded, the outcome is better. So don't take it away, because spirituality is part of the 360-degree wheel of wellness with family, career. So you need support. If somebody is going to the clinic, hospital regularly taking medication, but is in a hostile environment, in a toxic relationship, they will not get better. So we need family support. We need spiritual help. The person needs to be financially stable, whether you have a job or something that you are doing that is paying you. So everything all need to nip in the bud for it to move. But right now, the current problem we're having is that our mental health bill is still there. It hasn't been passed into an act. So it's waiting for the presidential approval, which we really hope before the next government comes in.
What's stalling that bill to be signed?
Bills need to be sponsored and all that. So luckily, it has been sponsored. It has gone through the readings and all that. A lot of galvanizing and collaboration and partnership has gone in. But of course, if it has passed through all the stages, it must still need the approval of the very head to say yes. So we need that, because a lot has been put into the new bill that will really help Nigerians. At least when we are looking at universal health coverage, when we are looking at more mental health services, with that, it's a policy document now. It's like the NHS turning to a National Health Authority Act now. If it's an act, we can have it to say, it's not an act, we need this to be done, X, Y, Z, and that we can push it. But not still a bill. There are certain things that will not hold waters because it's not an act. Like suicide is still criminalized in Nigeria. We need it to be decriminalized. Somebody that is suicide, that you now send person to prison, that's incarceration. Two things.
And you haven't helped the
You haven't helped. It's still a misdemeanor. 1 year imprisonment. We shouldn't do that. Our laws took the pattern of the British law. They have changed just long time ago in the 60s. Why are we still talking about if you attempted suicide, you should go to jail? Send the person to the hospital to receive assessment, treatment, management, get the family involved. If he doesn't have job, get job. If he's not, there's so many things you need to do to put things in place, but not sending them to jail.
Very good, Dr. Kadiri. Obviously, from the narratives you just explained, mental health issues needs a lot of patience in terms of treatments and all. But let's take a look at the institutions that are required to treat these patients, as it were, in terms of private or public. How would you assess their availability or lack of it in Nigeria at the moment? So, especially specialized institutions.
Japa
He's not helping matters as well.
The Japa syndrome. Listen, I took a deep breath, because I know what is happening in my own current ecosystem when it comes to mental health. Our services are needed globally. So our nurses, our psychiatrists, they are just, there's an exodus. Tsunami just taking place. So we don't even have the services are there, but you need people to run services. The human resources is very important in running these services. So if we have less than 250 psychiatrists for 200 million Nigerians, and also psychologists are also as few as us too, though of course they are more than us, but they are still few. How will we be able to deploy our services? So that is why I talk about tax shifting and tax sharing. What that does is that you treat people as mental health first aiders. So you treat people to be able to give these services so they can pick up early signs and symptoms in the communities. So mental health first aid World Organization has deployed what we call mental health gap. And what that mental health gap just means that people can be trained in non-clinical settings to pick up early signs and symptoms. So people can be taught here in our ICV. So if anybody is exhibiting signs and symptoms, it's easy for you to say, you need to go get help. And then other people will be trained on what to do before you now send to the psychiatrists or psychologists. So we need that in our schools, in our religious organizations. Why? Because those are they hold a very bbig chunk of our system. 2/3 of our waking hours is either you are in school as a student, you are at work, or weekend you are in church, or as a Muslim, you are doing a salat or something. So we need all those deployed in this part. So our education system actually need a revamp. Mental health services in our curriculum. So teachers' capacity building can be upgraded to teach them, and they can help the students strive better. Because most parents will go to school because a teacher said they should come to school. They will not come because they just want to come. So those are the things we need to do.
But what about, yes, you said the services are readily available. What about accessibility to those services?
So we talk about accessibility, availability, affordability.
There you go.
And acceptability of these services to us, and that is what encompasses universal health coverage. Are we there? No. In the next 10 years, we will be there? No. But we are a work in progress. Let's not give up hope. They are not affordable. Out-of-pocket payment by Nigerians in our health institution is still over 70%. We have less than 10% health insurance coverage nationwide. A lot of the HMOs don't have mental health services. Those that have mental health services is very skewed to the negative side. Like, they will give you just few days, list of medications you can go. And some people need more than that. Some people need monthly injection. Some people need some certainty. So you find out that affordability is really hard. But, health is a fundamental human right, but not healthcare. Healthcare globally is not cheap. Even if in a country where it is deployed as being cheap, the government is supporting, subsidizing and others. So government in Nigeria also need to look and redefine where our focus should really be as against, because healthcare financing is a huge deficit. Abuja Declaration said that 50% of the budget should go into healthcare.
All right.
We are not there yet.
Okay, still we're not there, but I still want to go back to the issue of brain drain. It's quite worrisome that we're losing a lot, more people than we took. So much, it took a lot of investment to get them trained than we're actually recuperating. So what is the impact of all this?
It's a lot on us. I run a private practice for the past 10 years now, and I know how we started and where we are now. Somebody comes to work in the morning, in the afternoon, the person is on the way to the airport, leaving. So, and you have to retrain. So even if you get a new person into the system, you have to retrain your organizational culture, the core values, the vision and the mission. So that is a huge toll in the system. And if we don't do something about it, it's a time bomb waiting to boom. Why? COVID has also shown us what it is. So we have to go back. It's not getting specialists, doctors to specialize. It's even getting those in secondary school to like science, to read medicine. I have 3 children. None of them want to read medicine. They say doctors are poor. so it's also making sure STEM, the science, technology, engineering, mathematics, that is also well inculcated into it, and improve and get more children interested in science so that they can be able to go into medical school and be able to read medicine, and then they can decide to specialize. So it's a huge burden. I'm bearing the brunt. And of course, I train in psychiatric hospital, Yaba, neuropsychiatric hospital, and I know what my MD there and my colleagues are talking about. People are exiting the system per second. So, and if we have that on a national scale, then there's a problem waiting to happen. So we still have to look at how can we do tax shifting and tax sharing and train people to fit in, to be able to help us, because we can't really do much if we don't.
And it's one thing to train them, but the experience has to be there as well.
Yes, because, so training them is to get them to be able to know do certain things and refer.
Okay.
So it's not get them to do end to end.
Okay.
How they can be able to manage. So I manage somebody in my hospital or they manage somebody in Yaba or Lut or Lasut. And person is on the mainland, has been treated.
Okay.
Person lives in Lakowe.
So it's a stopgap measure.
It's a stopgap. So if the person comes back to Lakowe, should be able to access the primary healthcare service there for follow-up, for refill of his or her medication. And if they notice there's something happening, maybe a relapse or whatever, imminent relapse, they can refer back to those government hospitals or places like us in Pinnacle Medical Services and other private hospitals. So those are the things we are talking about. They cannot do everything. We cannot do everything, but all of us can do a whole lot.
Okay. So to a large extent, in 1 minute, please.
Yes.
Where do you think the government should focus on regarding mental health currently, right now?
Pass the mental health bill into an act. Ensure that healthcare financing is top-notch. Yes, we have already the hope for this present administration is, but of course the budget is yet to be passed. Look into it. Healthcare financing is key. You cannot do much if the sector is lacking in finance, because equipments are needed, payments of human resources are needed. There's so much. So healthcare financing is very important. Mental health be done into making into an act is also very important. Encouraging our students. So we have to also go back. Encourage our students to be able to read sciences and be able to read medicine. Then of course, capacity building, deploy mental health services in our schools, in our religious bodies, in our work environment, and be able to do that. Because right now for us in our organization, we are working with 21 corporate organizations, working with over 1 million Nigerian employees and their family members. And what do we literally do? Help them, to create space where they can speak up and speak out, where they wouldn't be judged, where they wouldn't be criticized, where we wouldn't be apostolic towards them. So we have a lot of success stories of reducing the rate of suicide, because people can call us at any point in time of the day. It's 24-hour service, call center, and they can walk in if they think that, no, this is not just a call, I need to see a specialist, and they walk in and somebody is seeing them.
That's a noble cause you're doing there. Dr. Maymunah Kadiri, a mental health expert, of course a psychiatrist. Many thanks for joining us on Newsday. It's good to have you.
Thank you. Thank you very much.